Before we begin, I want you to take a moment and imagine something. Imagine waking up one morning feeling confident in your body again, feeling strong, youthful, connected to your masculinity, and no longer worried about performance, pain, or embarrassment. Imagine intimacy not being a source of stress but a source of joy. You know, so many men silently suffer when it comes to sexual health after 60, not because they are weak or incapable, but because nobody ever taught them how to care for their body as it changes with age. Most men were never given guidance about safe self-pleasure or the impact it can have on prostate health, blood flow, or erectile function later in life. And the truth is, the older we get, the more important it becomes to understand how to protect our sexual health, rather than accidentally damaging it. If you've ever felt worried about pain, numbness, reduced erection quality, or fear that something might be wrong, you are absolutely not alone. And today, you're going to learn exactly what most men never discover until it's too late. So stay with me until the end, because what I'm about to share could genuinely prevent injury, improve your performance, and support healthier erections long term. Now let's talk honestly and openly, as one trusted friend to another. Masturbation is a completely normal and healthy part of men's sexuality at any age. Many men over 60 believe they should stop masturbating because they think it's harmful, immature, or unhealthy. But medically speaking, that's simply not true. In fact, healthy masturbation can improve blood flow to the penis, support nitric oxide production, exercise the pelvic floor muscles, reduce stress, improve sleep, and even lower the risk of prostate issues. It can also help maintain erectile function because erections depend heavily on circulation, oxygen, and smooth muscle conditioning. If you don't use it, you lose it. This is a real physiological principle, so there is absolutely nothing shameful about wanting to maintain intimacy with yourself. In fact, I encourage it. However, and this is extremely important, many men over 60 make mistakes during masturbation that they don't even realize are dangerous. These mistakes can cause micro-injuries to blood vessels, irritation to the urethra, nerve compression, pelvic tension, desensitization, and even long-term erectile dysfunction. I've seen countless men in my clinic who thought they had a disease or prostate problem, when in reality, they were unknowingly damaging themselves with aggressive or unsafe habits. So today, we're going to talk about how to masturbate safely after 60, and how to avoid the 3 major mistakes that secretly harm men's sexual health. But before we get into those mistakes, let's talk about something that doctors rarely say out loud. Your body is not the same at 60 or 70 as it was at 25 or 30. Erections are slower. Sensitivity changes, hormones shift, blood vessels become more delicate. Nerves respond differently. The pelvic floor may weaken. And because of all these changes, the old habits that once worked, fast, intense, forceful, may actually be harmful today. Many men continue the same patterns they developed in their teenage years or early adulthood without realizing that their bodies need a different approach now. And it's not because anything is wrong with you. It's simply biology. Aging doesn't mean losing masculinity or capability, it just means adapting wisely. The good news is this. You absolutely can have safe, pleasurable, and deeply satisfying solo intimacy well into your 70s, 80s, and beyond, as long as you understand how to take care of your body. And that's exactly what we're going to dive into. So let's talk about the first key principle, slowing down. As men age, erections rely much more heavily on blood flow efficiency. That means the tissue inside the penis needs time to fill with blood. Rushing, squeezing too hard, or forcing an erection can actually restrict blood flow instead of supporting it. Many men worry that if they don't go fast right away, the erection will fade. But actually, the opposite is true. A slower, more deliberate pace improves stimulation, increases nitric oxide, reduces tension, and helps maintain a stronger erection throughout the experience. Think of it like warming up before exercise. You would never jump directly into sprinting without stretching. Your muscles would tighten and fail. The same is true for sexual tissue, so slow down. Allow arousal to build gradually and don't panic if things start slower than they used to. That is completely normal physiology. The second principle is lubrication. This is one of the biggest changes that's absolutely necessary after 60. Younger men often masturbate dry or with friction alone. But dry masturbation can be dangerous for older men. The skin becomes thinner, the vessels underneath become more fragile, and friction can create irritation, inflammation, and micro tears. These small injuries accumulate, reducing sensitivity and contributing to issues like Peyronie's disease, which is scarring and curvature of the penis caused by tissue damage. A high-quality natural lubricant can significantly reduce strain, protect the skin and nerves, and make the entire experience more comfortable and healthier. If you've never used lubricant before, trust me, you will feel a dramatic difference, not only in safety but also in pleasure. The third principle is relaxing the pelvic floor. Many older men unknowingly create tension in the pelvic muscles while masturbating, especially when they grip tightly or rush to finish. That tension can restrict blood flow and contribute to premature ejaculation, weak erections, or difficulty reaching orgasm. If you've ever felt numbness, pressure, or pain afterward, pelvic tension is often the reason. Taking slower breaths, relaxing the hips, avoiding clenching the buttocks or stomach, and using a gentle rhythm instead of a tight grip can make a major difference. Now, this brings us to the main subject of this video: the 3 dangerous mistakes men over 60 must avoid when masturbating. I'm going to break down exactly what they are, why they are harmful, and how to replace them with safe, healthy alternatives. These are mistakes that most men don't even realize they're making, and they are responsible for a surprising amount of sexual dysfunction later in life. If you've been experiencing reduced sensitivity, weaker erections, difficulty finishing, or post-masturbation soreness, one of these mistakes might be the cause. And once you understand them, you'll be able to protect your sexual health in a powerful way. In Part 2, we will go into deep detail about each mistake, explain what happens inside your body physiologically, and walk through the proper safe technique step by step so you can maintain strong sensitivity, healthy erectile function, and long-lasting performance. You're going to learn exactly what I teach my patients in the clinic, including how to improve blood flow naturally, how to strengthen the pelvic floor the right way, and how to maximize pleasure without injury. So don't go anywhere. Part 2 is coming next, and it will reveal the specific mistakes most men make without ever realizing the damage they cause. If you truly care about protecting your health and continuing to enjoy intimacy without worry, you do not want to miss what comes next. Welcome to Part 2, and I'm truly glad you stayed with me. If you're still here, it means you're someone who takes your health seriously, who values knowledge, and who refuses to accept decline as an inevitable part of aging. That mindset alone already places you ahead of many men your age. In Part 1, we laid the foundation for understanding why masturbation is not only normal but beneficial for men after 60. We also discussed why the body needs a different approach as we age. Now, let's get into the heart of the topic: the 3 dangerous mistakes men over 60 must avoid when masturbating, and how to replace them with safe, healthy habits that support stronger erections, better sensitivity, and long-term sexual wellness. Dangerous mistake 1: using a very tight grip or excessive pressure. This is one of the most common causes of erectile dysfunction and sensitivity loss in older men. Many men, especially those who grew up masturbating secretly and quickly, developed a habit of gripping extremely tightly to increase stimulation. While it may have worked during younger years, the same technique becomes damaging later in life. A tight grip compresses the blood vessels and nerves in the penis, reducing circulation and creating pressure on the tissues that need oxygen to stay healthy. It can even cause temporary numbness or a pins and needles sensation afterward. Over time, this repeated compression can lead to something called death grip syndrome, a real medical phenomenon where a man becomes so accustomed to extremely intense pressure that normal intimacy with a partner doesn't feel stimulating enough. Many men experience this but never talk about it, assuming something is wrong with their partner or thinking that their body is failing. But in truth, the nervous system has simply become desensitized due to excessive stimulation. A strong grip can also cause micro tears inside the erectile tissue. contributing to scarring, curvature, and reduced hardness. What to do instead? Use a lighter, more relaxed grip and allow sensation to build gradually. Use lubrication to reduce friction and prevent tissue strain. Imagine guiding rather than forcing. Let your hand mimic the natural sensation rather than overwhelming it. It may feel different at first, but over time, sensitivity actually returns and erections become fuller and healthier. Dangerous mistake 2, masturbating too quickly or treating it like a race. Speed may have felt necessary at 18 or 20 when privacy was limited and hormones were high. But after 60, rushing can create physical tension, interfere with blood flow, and prevent the body from going through a complete arousal process. Erections rely not just on physical touch, but on the brain, breathing, nervous system, and emotional state. When a man tries to finish as fast as possible, the body enters a stress response. Muscles tighten, breathing becomes shallow, and the pelvic floor contracts excessively. This tension restricts circulation and may cause pain, premature ejaculation, or difficulty finishing at all. Many men think they are losing ability when the problem is simply rushing. What to do instead? Slow down intentionally. Focus on deep breathing and relaxation. Let arousal build gradually like a wave rather than forcing it like a sprint. Take breaks, change rhythm, explore sensation. You will find that the orgasm becomes stronger, fuller, and more satisfying. Think of it like aging fine wine instead of chugging water. Time transforms the experience. Dangerous mistake 3, masturbating without proper arousal, warm-up, or lubrication. Arousal is not just mental, it's physical preparation. Just like you wouldn't lift heavy weights without warming up, you shouldn't stimulate your penis aggressively without allowing the tissue to fill with blood first. Trying to start stimulation before the penis is ready can lead to friction damage, difficulty maintaining an erection, painful orgasms, or soreness afterward. Some men even panic when they see temporary swelling, redness, or sensitivity loss, not knowing it's the result of insufficient preparation. What to do instead? Begin slowly. Take time to breathe, connect with your body, and let arousal build gradually. Use lubrication from the very beginning. You can also massage the area lightly, stimulate around the base, thighs, or perineum, or use gentle touch that isn't directly targeted right away. Treat the experience as something meaningful and enjoyable, not mechanical. Your body responds far better to softness and patience than to force. Now that we've covered the mistakes, let's talk about how to create a healthy technique specifically for men over 60. A safe and effective routine should follow 3 basic steps: warm-up, stimulation, and relaxation. Start by focusing on breathing, slow, deep breaths that relax the pelvic muscles and allow blood flow to increase. Avoid squeezing your thighs, clenching your belly, or holding tension in your hips. Allow the penis to warm naturally. Next, use lubrication from the start and use a relaxed grip. Begin with slow movements and gradually increase stimulation only as the body responds. Think of it as guiding arousal rather than forcing it. Throughout the process, continue breathing deeply and relaxing the muscles around your pelvis. When you reach orgasm, don't rush to stop. Allow the muscles to relax naturally and give your body time to recover. Many men also benefit from alternating hand technique, exploring different motions, or using lighter, rhythmic patterns instead of hard vertical strokes. You can even explore stimulating other areas like the perineum, inner thighs, or glands with soft pressure. The goal is to increase blood flow, sensitivity, and pleasure safely, not to reenact old habits from adolescence. Let's also talk briefly about prostate health. Masturbation can help move prostatic fluid, improve circulation, and reduce inflammation, which may lower the risk of infection or swelling. Gentle stimulation can be good for prostate wellness, but aggressive pressure can irritate the tissue and cause discomfort. If you've ever felt pelvic pain, soreness after ejaculation, or a heavy pressure feeling, that may be a sign that you need a gentler approach. Listen to your body and never push through pain. Some men also struggle with the emotional side of sexual changes. It's common to feel frustration, embarrassment, or fear when erections aren't as strong or reliable as before. But I want you to hear this loud and clear. You are not broken, you are not failing, and you have nothing to be ashamed of. Your body is adapting, and with the right techniques, you can still experience deep pleasure and intimacy. You deserve that. You have earned that. And protecting your sexual health is a form of self-care. Just like eating well or exercising, one powerful practice I recommend is incorporating pelvic floor relaxation and Kegel exercises. Many men think Kegels are only for women, but strengthening the pelvic floor improves erectile firmness, ejaculatory control, and sensation. Just remember, balance is key. Too much tension is harmful, controlled strength is beneficial. The easiest way is to gently contract the muscles you use to stop urine flow, hold for a few seconds, then release and relax fully. Doing this daily improves performance over time. You can also support your erection health with lifestyle habits like staying hydrated, reducing alcohol intake, walking daily, managing stress, and sleeping well. A strong heart equals a strong erection because erections are a cardiovascular event. Masturbation alone can't overcome weak circulation, but it can help maintain the system when paired with healthy habits. So let's summarize the core message. Masturbation after 60 is not something to avoid or feel guilty about. It is healthy, normal, and beneficial, but only when done with care, patience, and awareness. The 3 dangerous mistakes to avoid are gripping too tightly, rushing through the process, and masturbating without proper arousal or lubrication. When you replace these habits with gentler techniques, deep breathing, proper blood flow, and relaxed muscles, you protect your penis, support your prostate, maintain sensitivity, and improve long-term erectile performance. If you take one thing away from this video, let it be this. Intimacy is not about speed, force, or proving something. It's about connection. Connection to pleasure, to confidence, to youthfulness, and to the body you still own and deserve to enjoy. You are never too old to feel alive. Thank you for spending this time with me and for caring about your health. If this video helped you, I encourage you to share it with another man who might be struggling silently. You could change someone's life without even knowing it. And if you'd like more expert guidance on maintaining sexual health, prostate wellness, and strong erections naturally, make sure to subscribe and turn on notifications.